Hi guys, it's Laura. Sorry for my absence the past couple of days. I was pretty swollen and bruised. I still have some bruising left, as you can see here, and tired and a little drowsy and kind of out of it. So it was kind of hard for me to muster up the energy to make a video, and I do apologize. I definitely want to keep doing my best in uploading here so you guys know what I'm going through and what's going on and everything like that. And today I am feeling better. The swellingness has gone down, and the bruising is much better too. It was like all over here before and pretty uncomfortable. It was a little hard to smile about day 2, and then day 3 the swelling got pretty big. So anyways, I just wanted to keep you guys posted and let you know what's going on with me. Someone had previously mentioned that they would like me to make a video about updating how to the healing process after you get the surgery, and what to do, what not to do, and what you can eat and what not to eat, especially the first 2 weeks. So I have this list right here. This is from Revolution Dental. They gave me a list of what to do and what not to do after all-in first surgery. And I think that the best way I can explain this all to you guys is just to read this list through. And if you want to know about it, this is pretty thorough and should give you a good idea of what to expect, what to prepare for. So anyway, I'm gonna start reading this list to you now, and here we go. All right, oral hygiene. It is important to keep the mouth clean. Do not disturb the surgical area of the first day. Do not rinse vigorously or probe the surgical area with any objects. If there is minimal bleeding, saltwater rinses may begin 24 hours after surgery. Mix 1 tablespoon of salt water with 8 ounces of water. Swish gently and allow the water to drip into the sink. Rinses should be done 2 to 3 times a day, especially after eating. You can begin gently brushing your teeth with a non-abrasive toothpaste 48 hours after surgery. If you were prescribed chlorhexidine, a word I really cannot pronounce, sorry, mouthwash, you may begin using it 48 hours after surgery for 2 weeks only. I was not prescribed that, and I did not have to take that, so that's probably a good thing. Do not use your water pick for 3 weeks, which surprised me, honestly. Start using the water pick at the lowest setting and slowly increase the level setting as tolerated. Do not smoke during the healing phase. It impedes healing, causes discomfort, stains teeth, and causes implant failure. Sorry, having a hard time talking today. Okay, so on to the next one. Healing. The sutures you have in your mouth will dissolve on their own in a few weeks. Finish taking the antibiotic you were prescribed until all the capsules are gone. You will be given a night guard, which I do have, on the same day as your surgery. This needs to be worn every night while sleeping. If you feel like you are clenching or grinding, you should notify us immediately. You will have several checkup visits after the surgery, so the doctor can monitor the integration of your implants. Your doctor will decide when the implants are ready to start the process for final teeth, roughly 3 to 4 months. The post-operative course should be gradual, steady improvement. If you don't see continued improvement, please call our office. Okay, on to diet, which is a very important one, I should say. Well, they all are, but anyway. So avoid extremely hot foods and extremely cold foods during healing. Coffee and ice cream are okay, but quick, drastic temperature changes can break temporary teeth. Avoid straws for the first 5 days after surgery. For the first 2 weeks, you are limited to liquids or pureed foods only. Soups, puddings, yogurt, milkshakes, protein shakes, etc. Avoid hard, gritty, grainy foods. can get lodged in the surgical areas. After the first 2 weeks, you may progress to a soft food diet. Soft foods include anything that can be cut with a plastic spork. Yes, it says spork. Eggs, fish, mashed potatoes, pancakes, etc. Do not eat anything hard until you have received your final set of teeth, roughly 4 to 6 months. It is important not to skip meals. If you take nourishment regularly, you will feel better, gain strength, have less discomfort, and heal faster. If you are a diabetic, maintain your normal eating habits or follow instructions given by your doctor. And I have been following this to a T. I've been having soft foods like puddings, yogurts, jellos, meal shakes, things like that. And cream of chicken soup, which I really love. And that's been greatly helping me to get through this and giving me energy while I wait till, I can have more solid food. So, all right, moving on to oozing. It is common to ooze blood for 24 to 48 hours after surgery. Keep in mind that oral bleeding represents a little blood and a lot of saliva. Placing a wet gauze pack over the bleeding gum tissue and holding firm pressure without clenching teeth will help control bleeding. If oozing is still active, replace wet gauze as needed every 30 to 45 minutes. Use pillows or sleep in a recliner to prop yourself up while sleeping for the first few days after surgery to minimize swelling and bleeding. So I got myself a special pillow at Target, and it's really soft but firm, and it's pretty thick, and I've been using that every night when I sleep, and it's been greatly helping. And yeah, I recommend definitely getting yourself a comfortable pillow or two and propping your head up every night you sleep while you are healing. It's very important. All right, next one. Persistent bleeding. Bleeding should never be severe. Blood thinners or aspirin will also contribute to more bleeding. If bleeding persists or begins again by try repositioning the gauze. Sit upright or in a recliner. Avoid physical activity. Use ice packs and hold pressure using wet gauze for 1 hour or a moistened black tea bag for 30 minutes. If bleeding remains uncontrolled, please call our office. So as I previously mentioned, I do take Eliquis for a previous blood clot that I had and no longer have, thank goodness. And it did cause more bleeding. The first day, not so much, maybe a little bit, but the next day and the day after that, the bleeding was a little too much for me. So I can confirm that blood thinners or anything else they mentioned in there can definitely make you bleed a little more. I apologize. So I am confirming that. All right, on to the next side of the page. All right, we got activities. Activities after surgery should be couch or bed rest for the first 24 to 48 hours. You could get lightheaded when you stand up quickly, so be careful going from the lying down position to the standing position. Bending, lifting, or strenuous activity can result in increased bleeding, swelling, and pain. No physical exertion for the first week. Exercise, especially weightlifting, where teeth can be clenched, should be avoided for the first 2 weeks following surgery. After the first 2 weeks, activities should be light and dependent on how you're feeling. There is no problem with me there. I am fine taking it easy for a little while, and I hope that you would be too if you get the surgery. It's important. You don't want to overdo it while you're healing, and I do believe that's important, very. All right, now we are on to pain. Oral surgery is accompanied by some degree of discomfort. You will usually have a prescription of for pain medication. If you take the first pill before the local anesthetic has worn off, you should be able to manage any discomfort better. Some patients find that stronger pain medication causes nausea, but if you precede each pain pill with a small amount of food, chances for nausea will be reduced. It's not uncommon for people to begin tapering their pain medication as early as 5 days after surgery and feeling back to normal about 2 weeks after surgery. If you find you are taking large amounts of pain medication at frequent intervals, please call our office. Do not drive or operate machinery while taking narcotic medications. Definitely agree there. Next one is nausea. Nausea and vomiting can occur as a result of swallowed blood, discomfort, anesthesia, or pain medicines. Post-operative nausea is usually self-limiting. Take pain medication with food to help minimize nausea. If nausea persists, stop taking the pain medicine and substitute an over-the-counter pain medicine for the next dose. If nausea persists, call our office. All right, now we're on to swelling. Swelling is a normal occurrence after surgery and will reach its maximum in around 5 days after surgery. It can be minimized by sleeping elevated, using a bag of frozen peas wrapped in a towel and applied firmly to the cheek adjacent to the surgical area. This should be applied 20 minutes on and 20 minutes off during the first 48 to 72 hours after surgery. As my last video showed, I had the wraparound ice pack that goes around your head and attaches up here with the Velcro. I was wearing that for, let's see, 30 minutes off and on all day the second day of surgery, and about half the day the third day, and it did greatly help. And the swelling, once again, it's definitely gone down, and that's good. All right, now we're on to discoloration or bruising. Excuse me. The development of bruising is a normal post-operative occurrence that might appear 2 to 3 days after surgery. Everyone bruises differently. Black eyes are normal in rare cases and may take about 2 to 3 weeks to fully resolve. I'm happy to say that the bruising I had previously is going down pretty fast. So that is a good thing. I hope it continues to go away, but I'm sure it will very soon. Alright, so now we are on sharp edges. You can develop sharp spots or edges during the healing process. Occasionally, small slivers of bone may work themselves out during the following week or so. If they cause a concern or discomfort, please call the office. We can smooth them out if necessary. Sore throat. This is common after oral surgery, and this may make swallowing painful. This should go away on its own in 2 to 3 days. Yes, when I woke up from my surgery, I did have a sore throat, and my nose was a little bit sort of stuffy, but not much. I thought, oh no, am I getting sick? And then I remembered what they told me. That's just because they put a tube down your throat while you're in surgery. So, and that's for like hours, so it's definitely gonna do something to your throat, that's for sure. All right. And now the last one I see on here is stiff jaw muscles. The jaw muscles may be stiff following surgery, preventing you from being able to open your mouth as wide as your baseline. This is normal post-operative event that usually resolves 2 weeks after surgery. Do not try to stretch these muscles, just let them rest and heal. Alright guys, that is the whole entire list, and I've read you every single thing on there, so I hope that it has helped you in some way, at least with your curiosity. And if I left anything out from that list, if you're curious about anything else, please let me know. Comment below and just feel free to ask me anything. I'm an open book, and I appreciate you watching my videos. I hope you'll like and subscribe, and I look forward to talking to you again. Have a good night. Bye.